More gay and bisexual men are able to give blood under new donation rules that are now in effect. The U.S. Food and Drug Administration created new screening questions to reduce the risk of transmitting HIV. All potential blood donors will now be able to be asked the same questions regardless of gender or sexual orientation. Information about sexual partners and current medications will help determine whether someone is eligible to safely donate blood. The FDA's new rules are in line with other countries, including the United Kingdom and Canada. And the World Health Organization says Mpox is no longer a public health emergency of international concern. That declaration today follows a heated discussion and vote from the WHO's Mpox committee. It ends an official designation that's been in place since July of 2022 for Mpox, previously known as monkeypox. Lifting it doesn't mean the work is over, since Mpox still poses public health challenges. It just shows reported cases are down after 87,000 of them between January of last year and April of this year. And May is Mental Health Awareness Month. The National Institutes of Health estimates 1 in 5 adults live with mental illness in the United States. Health experts say now's a good time to prioritize self-care and take time to recharge. A psychiatrist says there are many types of self-care, but she asks her patients to focus on 3 of them. First, physical. That means getting exercise and an adequate amount of sleep, as well as eating right. Next is the emotional aspect of self-care. That's being mindful, maybe meditating or doing breathing techniques, or even journaling.
We kind of tack it on at the end of the day, or it's just one more thing to do. But self-care is really important. Really reaching out to family members and friends and really trying to build those friendships and get support from other people is going to be very important for us and our mental health and self-care.
The psychiatrist says some of these self-care techniques won't work for everyone. That's why she says it's important to keep trying different ways to take care of yourself. Find the ones that work for you and then stick to those. And now to the rising cost of cyber attacks targeting hospitals across the country. A new study finds most hospitals are woefully unprepared, and the impact on patient care can be substantial. Here's Lionel Moyes with more.
It's a growing problem for hospitals nationwide, cyber attacks. Experts say the number of attacks has doubled since 2016 and is driving up the cost of medical care for all of us. The University of Vermont Hospital Network knows the damage cyber criminals can do.
Our phones weren't working. We actually sent some staff to Best Buy to buy walkie-talkies, and we started switching over to our paper systems.
Dr. Stephen Leffler says the crisis stretched for 28 days. 1,300 hospital servers and 5,000 computers had to be wiped, a job so big the governor called in the National Guard. He says no patient data was leaked, but the impact on care was substantial.
We've had 3 years of COVID. This was much harder by a factor of 10. There were people that were scheduled for staging cancer operations, and we had to make a decision. Should we do it? And we did them when it was appropriate. Some we were able to delay.
Experts say hospital networks are ripe targets because they're often more vulnerable than other companies, and because hospitals are more likely to pay a ransom. In the Vermont case, the hospital ended up spending more than $50 million to resolve the attack.
A cyber attack on a hospital is not an economic crime. It is not a victimless crime. These are direct threats to patient safety and threats to life crimes.
A new government analysis finds nearly all hospitals, 96%, are operating with critical systems or software programs that have known vulnerabilities, but only 53% have a plan to address those vulnerabilities. Lionel Moyes, ABC News, New York.
And it could be a big breakthrough for people with peanut allergies. In a new study, researchers with DBV Technologies said an experimental skin patch to treat peanut allergies is showing some promise. Scientists tested the ViaSkin peanut patch on more than 350 toddlers. After a year, 2/3 of the children with a less sensitive peanut allergy could safely tolerate eating the equivalent of 3 or 4 peanuts. Children who were even more sensitive could tolerate the equivalent of consuming 1 peanut. And millions of Americans have been prescribed antidepressants for chronic pain, but a new study indicates that may not help. 1 in 3 people live with chronic pain. That's defined as pain that lasts more than 3 days. A 2-year study of 25 different antidepressants showed that only 1 of them appeared to be effective in treating the chronic pain. That medication is Dilextine, sold under the brand name Cymbalta. The study concludes that patients who fare best with chronic pain have close and consistent relationships with their healthcare provider. And a new report shows a sharp rise in violence at abortion clinics last year, the same year the Supreme Court ended Roe v. Wade. The annual assessment from the National Abortion Federation shows a disproportionate increase in states that protect access. Violence included death threats, arson, stalking, and even burglaries. The latest report features data from the U.S., Canada, and Colombia. Colombia is moving in the opposite direction as the U.S. after its high court legalized abortions up to 24 weeks last year.